I'm Sheila Han. My husband is Erik Han. We have 2 kids, Makenzie and Phoenix. Makenzie is 12. She is spicy. She loves Taylor Swift.
22, it feels like a perfect night. Hipsters made from my exes. I love Taylor Swift because she's so kind. I think she's a great role model, and she probably can't sleep because she's working on these songs all night. She's the greatest person ever.
She was about probably 18 months old when she started getting sick all the time. Her doctor said that I'd like her to go to another hospital to get checked out for this. They had tested her for some immune deficiencies. The one that she had was severe combined immunodeficiencies. She had no T cells and no B cells. You know, your B cells are like your memory cells. Those are the ones that, like, when you get vaccines, they remember those vaccines so that they can fight it the next time. And your T cells are kind of like your soldier cells. And so she had none of those. And so that was why she kept getting sick all the time. So they basically told us then and there that she was going to have to go through chemo and she was going to have to get a stem cell transplant for it. And then she had her first stem cell transplant on March 28th of 2014.
I had chemo. My hair was falling out. It's not good. Like, you feel icky all inside you, like bones and stuff. It's like super bad. I couldn't walk. I couldn't get out of my room.
McKenzie was born with something called ligase 4 deficiency, which is a problem with your immune system, but it also leaves you very sensitive to chemotherapy and radiation, which are standard treatments that we use for stem cell transplants. She got a transplant at a very young age, and unfortunately, that transplant donor developed leukemia just under a year after donating stem cells for McKenzie. When she was about 5 years old, her bone marrow started to show signs that it was developing leukemia.
As the weeks were going on and the doctor was kind of just watching her for those kind of complications, she had just asked me if I would be willing to go for an opinion at Cincinnati Children's. So she's like, there's this doctor, and like, this is where I think you should go.
For McKenzie specifically, the diagnosis of acute myeloid leukemia was even more complicated because of her underlying sensitivity from her ligase 4 deficiency. So she could not tolerate standard chemotherapy treatments that one would offer to other patients with acute myeloid leukemia. We made sure to get McKenzie here as quickly as possible and work on both her transplant treatment plan as well as getting an unrelated donor lined up and ready as quickly as possible. Unfortunately, despite our efforts, she did develop acute myeloid leukemia just prior to our planned initial transplant.
And I said, okay, like, how long should I pack for? And she's like, probably about 6 months. And I was like, wait, what?
Your life changed a little bit at that moment. It was heartbreaking, you know, seeing her when she was real sick. It was just, it was tough.
McKenzie's case is actually sort of the perfect example of changing the outcome together, as we would say. We needed a big team of folks to look at every aspect of her care, from our search coordinators who helped us identify the best possible match for a donor, to our nephrologists who helped us work with the fact that McKenzie only has one functional kidney. And once she developed acute myeloid leukemia, we knew we needed to be inventive, that we needed to look at cutting-edge therapies to treat that leukemia that would be less toxic than the standard approaches used in patients with standard leukemia treatment. We're able to tailor her targeted medication specifically for her size and for her kidney function. This was done along with experts in our pharmacology division and our pharmacy division who really have pioneered the use of this medication, which is typically in adult medicine, in the pediatric setting.
When we got there the first day, they greeted us, showed us around. It was just like, it felt like home, like as soon as you walked in.
She was originally supposed to only be in there for the conditioning and then the transplant and at least 30 days post-transplant. Unfortunately, her leukemia had progressed.
Our search coordinators were able to identify and clear Mackenzie's mom as a donor within a week of time, which is quite fast. And this is an urgent time during the transplant as well, so moving quickly is important.
We were thinking, like, yeah, we're gonna activate the search to see if we can find a 10 out of 10, but like, you're here. And so I was like, well, of course, like, I'm obviously gonna do anything I can for my child. Okay, this is what we're gonna do. Like, you're gonna donate to her.
My goodness, let me see. Hi, Nurse McKenzie.
So we're 6 years out as of this last bone marrow biopsy that we did in July. She is 100% my cells, so we're in remission. She's doing amazing. I remember waking up in the hospital after she had gotten the leukemia diagnosis and opening up Facebook and seeing Cincinnati Children's being named #1 for pediatric cancer and realizing in that moment that everything that had happened up to that point had happened to direct us to where we were. And I just knew it was meant to be, like, that's where we were supposed to be.
Dr. Myers saved my life. Dr. Amanda too. Both of them are the best people I ever had in my entire life. I love them to death. I do.
Just to know that there were people that cared about us when they didn't know us, that makes me feel super emotional.
I would just like to thank you, Cincinnati Children, for being the ones that gave Makenzie another chance at life.
There is just no place like it. It is the one place that you want to be.
I was very happy I had those doctors in need to help me. I love Cincinnati Children's.